Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force gives update on COVID-19 nationwide. Ikorodu residents receive palliatives from Lagos government after Channels Television's report on their plight. America prepares to open up again even as COVID-19 refuses to abate. Begin with the Nigeria Center for Disease Control (NCDC), which puts the total confirmed cases in Nigeria at 442, with most of the cases announced coming from Lagos. A breakdown of the cases in each of the states shows Lagos with 251 cases, the FCT Abuja 67, Kano has 21 cases, followed by Osun with 20. Edo State has 15, next is Oyo 13 cases, 9 in Ogun State, Katsina has 7, Bauchi, Kaduna and Akwa Ibom have 6 cases each, Ondo has 3 cases, while Enugu, Ekiti, Rivers and Niger each have 2 cases, with Benue and Anambra recording 1 case each. A total of 152 patients have been discharged, with 13 deaths recorded. And now, barely 24 hours after Channels Television did a story on the plight of the poor and vulnerable in the Ikorodu area, Lagos, the state government has stepped in. The Lagos State Commissioner for Information, Mr. Gbenga Omotosho, led the team distributing food items to the people of the area. According to him, the Lagos State government, since the commencement of the lockdown order, surpassed its target to provide palliatives for 250,000 homes. While receiving the items, residents say they are thankful, but insist on security as miscreants attempt to scuttle relief efforts.
This is something that started as soon as the federal government announced this lockdown. The governor said the poor people in our society are not going to be left to their own devices. And he said we are going to package food for them, the poorest of the poor. People are the lowest rung of the ladder, and we have been doing that. But yesterday you saw on Channels Television this particular street and a particular family that looked deprived, and he felt that we should reach out to them. That is the responsibility of the government to reach out to such families at this time, even though many prominent Lagosians and worthy Lagosians are doing what we are doing today, looking out for other people who they can assist. But the governor felt personally that we should intervene in this area, and he said we should come here today, and we are here today.
The Presidential Task Force on COVID-19 continues its briefing today on efforts towards curbing the spread of the virus. So far, 277 patients are being treated across the country, and as far as the Secretary to the Government of the Federation is concerned, the lockdown is making impact. The Health Minister believes that more cooperation is needed from the populace, and no matter how some patients decide to be uncooperative, the Federal Ministry of Health will not hesitate to investigate cases, even if the cases feel healthy. He also advised frontline health workers to adopt a safer approach for treating patients so as not to expose themselves.
There are 277 persons who have COVID-19 and who are being cared for in our isolation and treatment centers in Nigeria. This recent marked increase in the numbers of new COVID-19 cases is traceable to scaled-up implementation of our new case-finding strategy, as well as the result of rising community transmission. It means, of course, that the lockdown is yielding some of the results. With house-to-house and cluster testing and using the revised criteria for sample collection, the yield has increased. In this regard, I must again emphasize that all citizens are obliged to disclose complete and accurate information about themselves to the health workers they meet, especially about their travel history or contact with persons who have had or have COVID-19. Several health workers who must then self-isolate as a result of exposure to a positive patient will have to be out of circulation. This is not what we can afford with the limited number of health workers we have in our country. Infected persons need not hide themselves at home until their condition deteriorates, that they have to be rushed to the hospital in critical state. Some among the fatalities we have had may have been saved if they presented earlier rather than at the last minute. The accredited private hospitals, none that I know of here in Abuja. I think Lagos is looking at some accredited hospitals, and there's one large hospital in Lagos that has called me and say they want to become a corona treatment center. Now, the structure of the hospital is such that they are ready to remove all the present patients they have there and do nothing but corona. That would be good because they don't stand the risk of infecting of what we call cross-infection.
Well, for the Director General of the Nigeria Center for Disease Control, NCDC, it is good news, as he says the body is scaling up testing and screening.
A few days ago, I announced that we are developing a new testing strategy, and that strategy will be made available to everyone. Today, I'm pleased to announce that the national strategy to scale up access to coronavirus disease testing in Nigeria is now ready, and we've put it up on our website, covid19.ncdc.gov.ng. So anyone that wants to contribute to our testing strategy in any way can look at our strategy and see how they can fit in. We get offers every day. State governments get offers on all sorts of kits. People can see what exactly we're doing, what our direction of travel is, and how they can come in. This leverages on validated technology available for testing at the moment. It also illustrates our plans for a public-private partnership in different aspects of testing, what we are doing already and what we plan to do. Now, as you know, COVID-19 is unlike anything we've ever seen, and it has required a lot of very fast, critical thinking to come up with a way of responding to it. Now, although this is an evolving strategy, it was important to define all aspects of it. I know that it might appear that we have been slow to get this scaled up, but anyone that has followed discussions around this disease around the world will know that we are not the only country that has struggled with initiating mass testing in their settings. So we have had our challenges, but like with every other thing, it's not always the first person off the block that wins the race. So we have quietly put our heads down, worked with our partners, developed our strategies, made our plans, and now we're ready to scale testing in Nigeria.
Dr. Tosin Taiwo, General Practitioner Registrar, Queen Elizabeth King's Lynn Hospital UK, joins us now via Skype. Thank you for joining us on the program. Tell us, following reports of converting a series of sports venues, conference centres in the UK into field hospitals to treat the virus, how are things in the United Kingdom?
Yes, thank you for having me. So presently in the UK, we've converted 3 massive centres, one in London, one in Manchester, and one in Birmingham, called the Nightingale Hospitals, to over 1,000 capacity bed each for each one to help cater for these cases. Nonetheless, other hospitals are still caring for cases. This was done just because when we charted our graphs, we expected the peak and the spike just around the middle of April, which we are in now. what we call the eye of the storm, to get a big surge in patients. And the cases are being carted off or transferred to those hospitals for further treatment. But they are doing that, and the hospitals have opened for treatment.
We also understand that perhaps more of these cases are in care homes. Some reports are saying they're underestimated. Tell us about that.
I don't know, I wouldn't want to call it a scandal, but what the cases that are being reported here are actually hospital deaths. I don't know if you understand how the care home system works. Over here, the elderly population, if are not staying with a family member, are being cared for in care homes by other people. So those care homes are scattered all around the country in different places, and they have a population of anything next up to 30,000. And unfortunately, deaths that happened there, if are not tested, will not be counted as deaths. So it just came to the knowledge of the government that there have been unreported deaths there. So that's one of the things that they are looking into now, to scale up testing into care homes in the country.
Now, just before we come to talking about Nigeria, we hear the UK is creating a vaccine task force to tackle the virus. But we've been told that the vaccine research normally takes years, some say even decades. So with the race to develop this vaccine in just months, do you think we will succeed?
Well, they have assured us from the University of Oxford, the scientist, I think Professor Sharma, I'm not sure about her name, has assured us that they are getting good results from the initial trials. They've planned to start clinical trials probably on Monday, from what I gather, and hopefully they will track down and say they'll have something by autumn. The reason vaccines take long periods of time is because there's a lot of bureaucracy. We've got to go through a lot of ethics and look at the trials. But given the current situation we're in, there will have to be a lot of red tape cutting to get to it quickly, because we do need the vaccine. And obviously, America is testing the vaccine as well. So it's very good that we too as well.
Dr. Taiwo, what's your take on how Nigeria is doing? We're hearing talks from the PTF, Presidential Task Force on COVID-19, that they're increasing testing and capacities. So far, 12 testing facilities in about 8 states, and Lagos is testing 1,500 per day. The FCT is doing 1,000, and other states, we know the UK is doing way higher than that.
Yes, I actually have to commend the government on what they're doing. Like initially stated, every single country has struggled at the initial onset to get started. America was slow. The United Kingdom was slow. Many other countries. I think the only country that probably wasn't slow was South Korea. And that's because they were kind of ready for it. I don't know if you know, about 5 years ago, South Korea went through the MERS pandemic on their own. So they had a bit of a testing center ready to go. So I'm happy with what's going on. The testing has been scaled up from what I gather in Nigeria. More people are being tested, and we're getting more numbers and treating and isolating people accordingly. We will like to see more facilities open. I also know that there's a public-private partnership ongoing to get other private hospitals involved as well, which is also a good incentive and initiative. I've not looked at the strategy that the NCDC has put at the website in detail, but I'm sure they've got great minds working on it.
Finally, the UN says we're also fighting an epidemic of harmful falsehoods and lies. Would you say the UK has a share of the problem of misinformation on the coronavirus?
It's a big one. The US is a bit different kettle of fish. They've got a president that he tweets at every single minute that he gets. In the UK, we get information. There is misinformation, but there are standardized sources of information where people know to go to. Obviously, whatever we hear on social media has to be taken with a pinch of salt and looked at properly. But I wouldn't say there's mass misinformation everywhere in the UK. There will be some, but I would not probably compare it to America.
Appreciate your time, Dr. Tosin Taiwo, GP Registrar, Queen Elizabeth, King's Lynn, Norfolk in the UK. Thank you for joining us.
Thank you.
Still to come on our COVID-19 updates, we'll tell you some state government strategy to stemming the pandemic. Do join us again. While the infectious disease outbreak affects each state differently, here are the different measures a few states are implementing. Let's begin in Jigawa State, which has recorded its first case of COVID-19. The Commissioner of Health, Dr. Abba Zachary, who confirmed this to newsmen, said the index case was on his way back to Jigawa from Lagos, but tested positive for the virus in Kano State, en route, that is. According to the state government, the patient has been moved from Kano to Dutse, the state capital, after being rejected for treatment. Yola, the Adamawa state capital, where the Victim Support Fund, VSF, says it is within its mandate to protect vulnerable families and the poor within the urban areas to prevent the outbreak of COVID-19, and that is by providing relief materials to them. This disclosure was made by the VSF task force while donating food items and medicals to the Adamawa state government worth millions for distribution to IDPs and the most vulnerable families in the state. From the Federal Capital Territory, in line with the efforts of the Nigerian military to tackling COVID-19 pandemic, the Armed Forces of Nigeria has announced plans to provide the minimum necessary force to support the Nigeria Police Force and other security agencies to checkmate the nefarious activities of criminals who are out to take advantage of loyal citizens observing the lockdown directive. Addressing a news conference in Abuja, the coordinator of the Directorate of Defense Media Operations explained that all the 6 geopolitical zones are covered by the Armed Forces of Nigeria to ensure total compliance with the order restricting movement. And the total lockdown imposed by the Kaduna State government is resulting in huge losses to the hospitality industry as well as other businesses in the state. Though the quantum of loss is yet to be ascertained completely, the hoteliers however, expressed concerns that except there is a provision, a stimulus package by government as a post-COVID-19 lifeline for the sector, more jobs will be lost in the days ahead. And finally, Rivers State Governor Nyesom Wike has announced that security agencies have arrested 22 staff of ExxonMobil who entered the state from Akwa Ibom in violation of the state's executive order. Addressing a press conference in Port Harcourt today, the governor stated as a responsive government that they have been quarantined in line with the relevant health protocols and will be charged to court. Now, one of the patients released from the mainland hospital for COVID-19 and former Commissioner of Sports, Ogun State, Mr. Bukola Olopade, has been telling us his survival story on the coronavirus. While speaking to our correspondent, Nota Egbe, in an exclusive interview, he appealed to everyone who has been feeling unwell to trust the healthcare workers and get tested.
Whilst I'm praying for people not to catch this, I'm also begging and appealing to people, especially those that can influence, because I am an influencer in the society. I have a lot of young people in Ogun State who look up to me, and I'm very glad that a lot of them have reached me to say, after they saw my video, they now believe that COVID-19 is real, and since then they've started practicing social distancing and respecting all the advice from the Ogun State government. People should just trust the healthcare workers and go out and get tested. The joke will be on the person that is stigmatizing, because the truth of the matter is, once you've gone through it, you've been treated, and you're negative, you are the one who should be careful of people who've not had it, who may be asymptomatic and may not know. And so the care is for you not to be reinfected and not for you to infect people. So what would be the essence of stigmatizing anybody if really and truly those of us who have gone through it, who have defeated it, are the ones who should be careful of those who don't have it yet? I think the education must go out to let people understand that stigmatizing people like me who's had it will be ludicrous, because science has shown that it is those of us who have beaten this virus that must be careful of those who have not had it, and some who may be asymptomatic, who may reinfect people. So we are the ones who are being careful now. And that was why I said to you when I saw you that, hey, my friend, social distancing, don't come near me.
Over in Edo State, 5 persons confirmed to have the virus have now been discharged after testing negative. Following the total number of 121 suspected COVID-19 cases in the state, 15 have tested positive, with 1 death recorded. All the positive cases have been receiving treatment in isolation centers in Stella Obasanjo Irua Specialist Teaching Hospital and the University of Benin Teaching Hospital. The State's Commissioner for Health, Dr. Patrick Okundie, said that the sixth person is responding to treatment.
Clinically, everything, he has met all the criteria. There have been a total number of 121 suspected cases of COVID-19 since the first outbreak, and out of which we have 15 positive cases and unfortunately 1 death. All the positive cases are receiving treatment in isolation centers in Stella Obasanjo Hospital, Ira Specialist Teaching Hospital, University of Benin Teaching Hospital.
Joining us now to dissect the issues of the pandemic is Dr. Ndidi Igwe, a public health physician. We'd like to welcome you to the program.
Thank you for having me.
All right. Looking at the cases, since you've been here, because I know we spoke to you a little earlier on, we've seen an increase in cases. Are we seeing an invisible line of transmission with the rate of cases we're seeing today?
Well, I will not really say it's an invisible line. And the increase we're seeing in cases is actually a result of the active case search we have engaged in the past, over a week now, the past 14 days. Listen, we've been entering the houses, we've been entering the different health facilities, including the labs, and fishing out people. So that is why we're having this increase.
When you say fishing out, it's almost as if they're hiding.
No, some people may be ill in their house, and because of the stigmatization or lack of knowledge, I'll say, because it's ignorance, they will stay there. So we go look out using the criteria for the case search, and we get those ones. And now even the testing strategies has been increased. In every local government area, there's a designated center in Lagos now where they're testing people. So those people were able to get that has the case symptoms similar to the case definition. They are all being tested. So the increase we are seeing is not really, they can't be traced because people have not really been practicing that social distance. By the time you go into the communities, you see them. People need more education. People would rather come out from their houses and gather in clusters. I know the kind of housing system we have in our country, in Lagos in particular. People will gather in clusters, gisting, that social distancing, the hand hygiene, the respiratory hygiene. People are not really practicing that. So
is it a case of misinformation or people are not properly educated? And, you know, is this also why we're having this stigma?
Yes, I'll say that people need more education. We need to intensify the education. People are having some negative... Some people have called me to say they don't think this exists. That's COVID-19. They think it's a way governments want to use to find money that they will eat. So people need more education to be able to understand that this thing is real. There's no two ways about it. And then be able to practice all these preventive measures that we have that the government have outlined for people to follow, which includes the hand hygiene, respiratory hygiene, that's you cough into your arm, social distancing, and then we talk of face masks. Face masks should not take over the other ones. It's just a way to boost the other preventive measures. And the face mask, like the SCD has said, it's advocating that, okay, more people can use it, but please don't use the surgical face mask. Leave it for the healthcare workers who are the frontliners. And you can use your cloth mask. Especially when you're going to a crowded place, maybe like a market, you're going out to the stores, you're not sure of the contacts you're going to have. Protect yourself. You're not even sure of yourself as it is. So protect yourself and protect others. You can use your closed face mask.
We appreciate your time, Dr. Ndidi Igwe, public health physician. Thank you for joining us at this time.
Thank you.
Well, news we're getting says 14 people have been reported killed in a fire outbreak at the internally displaced people's camp in Ngala, Borno State. Many other people are also said to have been injured, while property, including homes, foodstuff, were destroyed in the inferno, which reportedly started as early as 2:15 p.m. yesterday, Thursday, April the 16th. In his response to the deadly fire, President Muhammadu Buhari has described it as extremely horrifying and directed that needed assistance be immediately mobilized to the victims. He also directed the Ministry of Humanitarian Affairs, Disaster Management and Social Development to investigate, report the circumstances leading to the incident, and recommend ways of avoiding a future occurrence of such incident. The fire is coming 2 days after an earlier inferno destroyed about 700 homes, also at an IDP camp in Mafa local government area. That's also in Borno State. And the NCDC continues to work with frontline healthcare workers and also states. You can find the latest on the national strategy to scale up access to COVID-19 on its website, disease testing in Nigeria, other public health advisory as well. The website comes alive with information and statistics on the cases. So also the World Health Organization, the global strategy on their website guides the public health response at both levels, subnational and national levels, with practical guidance for strategic action tailored to local content. Well, that's our COVID-19 update. Another update comes your way again at 9. Thank you for watching. I'm Millicent Wonga. Stay safe.